Good afternoon, everyone. It's a great honor to be here today and be part of this session on a very pressing public health issue on criminal justice and human rights. My name is Milo, and the title of my talk is Criminalization of Same-Sex Behaviors is Harmful to Public Health. Significant reductions in access to HIV prevention and care services associated with arrests, convictions for sex between men. Before I begin, I wanted to acknowledge the contributions of my co-authors, Coletso Macofane, Sonia Ariola, Jack Beck, Patrick Wilson, Pato Herbert, Trido, and George Ayala. As you all know, men who have sex with men worldwide are disproportionately impacted by HIV. The prevalence of HIV among MSM are much higher than the general population across the globe. To deal with the sustained and in some places worsening epidemic, scale-up of evidence-based HIV prevention services such as HIV and STI testing, STI treatment, condom availability, as well as HIV treatment and care are urgently needed. However, even if we scale up these interventions, for many MSM, structural barriers, including external homophobia and legalized discrimination, restrict access to these critical and effective tools against the fight against HIV. Hence, the scale-up of basic program activities will not be sufficient to eliminate HIV. An effective HIV response will require careful attention to the critical enablers and the need to revise laws and legal policies that criminalize behaviors of key populations, including MSM, to successfully reduce HIV risk, HIV transmission, and reduce HIV morbidity or mortality. That said, we have a lot of work to do, as same-sex intimacy is criminalized in more than 76 countries, with punishments ranging from fines to arrest to imprisonment and death. It is estimated that over 2.79 billion people live within these countries where same-sex within these countries that criminalize same-sex behaviors, which means that more than 2.79 billion people live in a country where the response to HIV is undermined by the laws in their countries. We know this from empirical data, which have consistently shown that higher levels of external homophobia reduce access to effective evidence-based interventions. For example, my colleagues from the Global Forum on MSM and HIV and I have observed in a global sample of MSM that higher homophobia was independently associated with significant reductions in access to condoms, lubricants, HIV testing, and HIV treatment. Building on this work, in this current study, we sought to evaluate the prevalence of arrests or convictions for same-sex behaviors among MSM worldwide. We also sought to assess the impact of these arrests and convictions on access to critical HIV prevention and care services. Specifically, we wanted to explore whether there are significant differences in access to services between MSM who are arrested or convicted for being MSM compared to those who have no history of arrests or convictions for same-sex behaviors. We conducted a secondary data analysis of the Global Men's Health and Human Rights online survey, which was administered in 2012 in 6 different languages. That survey gathered self-reported data on lifetime arrests and convictions for being gay or MSM, and also assessed levels of accessibility for different evidence-based health services and HIV treatment services. We evaluated differences between those who reported lifetime arrests and convictions versus those who did not in access to these evidence-based health services using generalized estimating equations or GEE models. And we accounted for clustering by country using robust standard errors and adjusted for potential confounders, including age, being an ethnic and racial minority, education, and housing status. This secondary data analysis included 4,020 men who have sex with men globally. The mean age of the sample was 35. 26% of the sample were from Asia Pacific region, 26% were from Western Europe and North America, 17% were from Eastern Europe, Central Asia, 15% were from Latin America, and the rest were from the other regions across the globe. The majority of the sample reported being college educated, and 17% of the sample were living with HIV. In this sample of 4,020 global MSM, 1 in 12 MSM reported being arrested or convicted for same-sex behaviors. By region, we observed that the lifetime prevalence of arrests and convictions for same-sex behaviors among MSM varied greatly. In Oceania, the prevalence was 2.2%, while in North America and Western Europe, the prevalence was 2.3%. In Asia and Pacific, the prevalence was 4.1%, and in Latin America, the prevalence was 9.7%. In the Middle East and North Africa, it was 13.2%. In the Caribbean, 15%. In Eastern Europe and Central Asia, 18%. And in Sub-Saharan Africa, 23.6%. Nearly 1 in 4 MSM from our sample in Sub-Saharan Africa reported having a lifetime prevalence of arrest and conviction for same-sex behaviors. In the multivariable GEE regression models, we found that those who reported arrests and convictions also had significantly lower restricted access to HIV prevention services, treatment, and care. Specifically, for these men, they had 0.82-fold lower odds of access to STI treatment, 0.8 lower odds of access to HIV testing, 0.79 lower odds of access to STI testing, 0.77 lower odds of access to condoms, 0.74 lower odds of access to mental health services, and 0.68 lower odds of access to medical care. In addition, among those living with HIV, those who were arrested and convicted for same-sex behaviors had 0.48 lower odds of access to HIV treatment. This study has several limitations. First, it's a convenient sample of MSM worldwide, so our findings may not be generalizable to everyone. Second, we don't have the ability to establish the temporal sequence between arrests and convictions and access to services across this cross-sectional survey. And third, we collected self-reported data which may be subject to measurement bias. Despite these limitations, this large global sample of MSM, this data on a large global sample of MSM have many important contributions to the field. Our data show that the prevalence of arrests and convictions for same-sex behaviors are high, especially in Sub-Saharan Africa, the Caribbean, Eastern Europe, and Central Asia, and the Middle East and North Africa. And let's be absolutely clear, these criminalization laws are not just symbolic. They are being enforced to deprive MSM of their basic human rights and freedoms. Our analyses highlight how enforcement of punitive laws for sex between men have a strong negative impact in access to HIV prevention and care services among MSM. Those subjected to arrests and convictions for being gay or MSM reported significantly lower access to evidence-based interventions proven to reduce HIV acquisition and transmission. Criminalization of same-sex behaviors is undermining public health. This demonstrates that decriminalization of same-sex behaviors are urgently needed to effectively address HIV among MSM and respond to the public health needs of this population. Ultimately, ending AIDS will not be possible unless we end criminalization of same-sex behaviors. Thank you, everyone, and I guess I'll be around for questions at the end. Thank you.